Hi, this is Daniel Shmoon, and in today's video I'll be presenting an assessment of the effects of transcranial direct current stimulation on autism spectrum disorder. Today's presentation includes an introduction wherein I will provide overviews of transcranial direct current stimulation, also known as TDCS, and autism spectrum disorder, also known as ASD. Next, I'll talk about some recent applications of TDCS on autism and provide some examples. And finally, I'll provide a critical analysis and suggest some directions for future research. So TDCS is a non-invasive brain stimulation technique used to facilitate either increases or decreases in cortical excitability, making an action potential more likely by utilizing a positive electrode known as a cathode and a negative electrode known as an anode. Now these electrodes are placed on specific regions of the head or parts of the body situated near the head. Now, typically they are localized using a 10 to 20 electroencephalogram, also known as an EEG, or via neuronavigation by MRI scans, also known as magnetic resonance imaging scans. Now, the latter tends to be more accurate, but also is mostly only utilized if past scans are available. Now, typically TDCS utilizes 1 to 2 milliamps, with some studies using up to 4 milliamps in stroke patients, for example. The duration of use is approximately 20 minutes, but common within the 5 to 30 minute range. Now, importantly, there is a control condition which may be utilized, known as a sham condition, wherein small amounts of current typically induce tingling or similar, without influencing cortical changes. This controls for the placebo effect. TDCS is utilized in treating, enhancing, and reducing a wide range of phenomena associated with cortical areas, including socialization, cognitive functioning, awareness, schizophrenia, chronic pain, and more. Now, autism spectrum disorder, or ASD, comprises an array of individuals with diverse deficits of the socio-cognitive and communicative nature, in addition to being characterized by restricted repetitive behaviors, aka RRBs, and stereotype behavior. Autism is a wide spectrum comprising high-functioning individuals to severely affected individuals with strong behavioral and communication deficits. Interestingly, those with higher levels of autistic traits sometimes appear to have reduced identification of social stimuli, but enhanced identification of non-social stimuli compared to neuronormative individuals. ASD is associated with both developmental abnormalities in addition to dysfunctional neuronal activity in cortical areas, most commonly within the dorsolateral prefrontal cortices. A 2018 meta-analysis conducted by Tick et al. Indicates approximately 74 to 93% heritability of ASD, and prevalence is such that males and females are diagnosed at about a 3-to-1 ratio, meaning that for every female diagnosed, 3 males are also diagnosed. Moreover, those on the autistic spectrum comprise approximately 1.7% of the Australian population. Treatments for ASD are vast and include medication, psychotherapy, and speech therapy, as well as additional learning support and more. So what are the effects of transcranial direct current stimulation on autism? Let's look at 3 recent research articles. Firstly, a case study conducted by Wilson et al. Successfully improved social functioning in a man with autism spectrum disorder. They incorporated 8 30-minute sessions consecutively over 8 days, utilizing the anode over the right temporal junction. In the case of working memory, Van Steenberg et al. Found TDCS effective in enhancing working memory in 12 autistic adults, with anodal stimulation applied on the left and right dorsolateral prefrontal cortices during tasks. And the final example outlines Q et al., who applied anodal stimulation over the left dorsolateral prefrontal cortex, finding significant reductions in the child autism rating scale, among others, following the application. Importantly, some autism-related measures also underwent significant changes with the sham control condition in this particular study with Q et al. In sum, a recent systematic review and meta-analysis conducted by Garcia Gonzalez et al. Concluded that although contemporary research covering the effects of TDCS on autism is not proven, it does remain promising. concluding that there is emerging behavioral, social, and learning benefits. Now, critically, there are some arguable inconsistencies or limitations centered on current research and methods regarding the use of TDCS on autism. Firstly, at this stage, there are a limited number of controlled trials. This can be predicated on the fact that research in this area appears to be somewhat in its genesis or at its beginning. Now, because of this, a lack of control group homogeneity can be observed across studies. Secondly, evidence of long-term effects is lacking, meaning that drawing valid conclusions for the efficacy of TDCS treatment on autism across time is not yet possible. Thirdly, there is currently a lack of large sample sizes. Now, this may be due to the fact that it is difficult to gather a large range of individuals with autism for experiments of TDCS, especially after exclusion criteria is met. There may be ethical concerns for such things preventing sample sizes from increasing. For example, individuals on the autistic spectrum with higher sensitivities and lower abilities may find it difficult to participate, as well as there being difficulty in measuring outcomes for such individuals. Lastly, questions arise as to whether treatments as transcranial direct current stimulation are going to be as effective for autistic individuals as other pre-established interventions. Stemming from this, another ethical dilemma may arise such that the treatments which statistically achieve the best outcomes may be preferable instead. In conclusion, future research ought to focus on, firstly, a consensus among researchers in the area to establish protocols of standardization with regards to control scenarios. Secondly, longer studies or longitudinal studies should be incorporated to ascertain the reliability of results across time. And lastly, increases in sample sizes are required to enhance statistical power and validity.